imagine a supraspinatus tendon right here, or a muscle tendon under the acromion and to the greater tubercle. Do you mind if I kneel on the table with you?
No.
A lot of times I do get up on the table with the person so I can press down with my thumbs. Okay. What I want you to do is just raise up to about there, 45 degrees, and then back down again. Okay. I'm going to start as kind of as distal I can on the tendon. Are you okay? Okay. Up we come. A little bit too much flexion. Bring your arm back to neutral. Okay, there we go. That's 2. Keep going a little faster. There's the crunch. 3. 6, 7.
You're slowly adding in more flexion.
Yeah.
Oh, am I? Thanks.
You want to try and get out of it, right? Okay, that's 10. So how was that? It's okay?
At first,
Quite a
like,
bit of, yeah. Quite a bit of pressure.
Okay. Now I'm going to go about halfway up in the middle. So I'll do 3 on this, right? So halfway up. So we're kind of more in the muscle tendinous junction now. Okay, go ahead.
Feel that all the way up to my mastoid.
Uh-huh.
Michael, any of these videos, would this video be on YouTube or only on Facebook?
This could be on YouTube.
Okay.
I think that was 10, but I think I lost track because, okay, good.
So where were your thumbs the first time when you were?
As distal onto the shoulder, superior part of the shoulder as possible, right? So here's the acromion,
Yeah.
and just before it, just proximal to it's that right there.
So you're on the tendon? All right.
Yeah, the tendon. Right? And then the third one, depending on the person, now you've got well-developed trap, right? So I don't want to go through all that well-developed trap. So I'm going to take my thumb, kind of slide the trap back, and then press down onto the belly, and then go ahead and do it again.
So you're still on super spin?
Now we're on the belly of supraspinatus.
are both like front and back?
I've got to stabilize the kind of the scapula from popping out.
Okay.
It's like a lot of crazy angle on the thumb.
Yeah. Sometimes I can go right through, but not in this case because
Yeah.
she's fit. She got a nice thick trapezius. Okay, and then how does that feel to move your arm now? I still feel it a little cracky. It's
Yeah,
probably
still
AC
punchy,
joint now.
but- Oh, really? Yeah, still punchy, but,
I'm going to test your AC joint.
okay.
Anybody know the test for the AC? Like that? That's one test. Second test, horizontal adduction. Third test, high reach. Any pain with any of that? Okay. All right, next is the infraspinatus. Okay, so here's the infraspinatus muscle belly tendon. So just as it kind of disappears underneath the deltoid, I got to put my thumb on the tendon there. And what you're going to do is hand to belly, all the way out, hand to belly. Okay, and go ahead. That's eccentric, that's concentric. Eccentric, concentric. Contractile myofascial release.
Or maybe you meant to put pressure on the front too, so just,
You know, just kind of
oh,
pinch your grip, right? Okay, good. Doing okay so far? Or the temperature is rising on this side versus the other side now. Okay, and again, and then I got to go halfway along the muscle, got a muscle tendinous type area. Okay, go ahead.
pressure?
Definitely in the infraspinatus.
Are you in the middle of the infraspinatus? On the scapular spine?
But halfway.
Halfway? Okay.
Because by the time she's moving, you're getting this part and then this part, right? So you're kind of getting, in this way, you're getting most of the muscle. Now I'm coming very close to the origin on the scapula. So if you take the kind of the root of the spine, drop below it in there. Okay, go ahead. Okay, I think that was about that. Don't rush through it. Give your fingers a little break in between, or traction your thumbs or whatever you're using to pinpoint with it. So we're going to do subscapularis next, okay? And I think, can someone just throw me a sheet or right there, Ken, there's one? Got it, just so you're not lying on the final table. This side. I'm just gonna grab a chair. So, okay, so here's the scapula right in here. I'll take the scapula, slide it out as best I can. Just relax there for a moment. Okay, onto subscapularis. And so you're going to go up and then back to hand on tummy like that. Okay? When I say, not yet. Okay, just to test it, put your hand on your tummy. Press in. Yeah, I got it right there. Okay. Now we're ready to start.
Where are your fingers there?
Just to stable, just a counter pressure for my.
So you're going to try and keep the scapula still?
No, I'm not. I'm just applying counter pressure so I can push in with that.
Okay.
If I don't have this hand, it just goes away from me.
Okay.
The scapula. 2. Good girl. Keep going.
Yeah, lots of sensation there.
You can go a little faster if you want.
So what are you experiencing?
It definitely gets some, yeah, like right there is where I feel the most sensation.
Your
I'm almost getting a
pressure
referred,
doesn't change, it's just.
Solid.
pain, not really pain, but sensation to here.
Well, that's where the attachment down there, right?
And the whole muscle belly is kind of like on the anterior aspect of the scapula. So are you aiming for when it's kind of like leaving to go towards the here? Like it's, do you know what I mean?
Not really, but I'm just pinning the muscle and just having it go through the full range.
Okay.
I think 2 more would be good. Is it lessening at all?
Yeah, it is. Yeah.
You can, if you bring the camera on, you can see how my thumbs are still, or fingers still look quite white from the pressure, right? So there's lots of pressure there. Okay, good, that's fine, good. Now, so you got lots of blood flow in those muscles. Now you do the arm pulse, right? That you can kind of adds to that. The hand back here was just, if I didn't have my hand here and I just press it here, that scapula just moves too far away from, it gets away from my presser.
So you're stabilizing a little bit with the.
Yeah, kind of. But that's not the purpose, it's just counter pressure.
I do, so I'll talk to you later.
I'll talk to maybe someone else has the same question.